Hey everyone, welcome to my channel. My name is Sarah. I have surgery I'm going to the hospital in about 45 minutes to get the surgery done on my hand to get that carpal thing removed. So I just figured I'd start this video now because that's what I usually do with surgery. It has nothing to do with epilepsy, but in case anyone comes across this video and wants to see the process. I just showered. Every doctor and hospital is different with their instructions and stuff. Like when I got my VNS, both times I had to shower beforehand, but this morning they told me to shower the morning of, which I hated doing. Yeah, and I stopped eating around midnight last night and drinking, so I've only been able to take small sips of water with my meds that I'm allowed to take, which luckily is both. And brush my teeth as long as I don't swallow water. Yeah, so I have to be there at 7:30 and it's almost 7, I think, but it's pretty close by. So see, I think that's it so far. I might be missing something, but I'm not nervous for the actual surgery. I just get nervous for like the prep beforehand because I just do. Like right now I'm super anxious just because I hate preparing and I hate waiting. So anyway, I'm going to go now. Wish me luck. Except by the time you see this, I'll already be done. And I don't know when I'm uploading this because I won't be able to use my right hand. So we'll see. But hopefully it'll be soon. Yeah. Okay. Bye. Hey everyone. It's been a few days, but I just wanted to, show you this. This is the aftermath bandage thing. It's hard to turn my hand, so I don't do that. Basically, this is what it looks like. I keep it on ice sometimes, which is under there, but I'm holding my left hand is being used, so I don't use my right hand. See? Anyway, my surgery was on Tuesday, but I decided, basically, I've been so out of it and in pain, so I have not been recording anything, and yeah, so that's it. It's been fun so far. The pain meds have really been helping. I'm on oxy stuff and Tylenol stuff. It's like Tylenol arthritis stuff, I don't know. And then I'm also on Zofran for nausea, and I think on naproxen as well. But I'll probably be going off of the oxy pretty soon because it's not as bad as it was, so, and plus I'm running out anyway, so here's my hand. Well, kind of like my arm. I'm not showing my face because I look gross. I've been sleeping a lot, like a lot. Today I'm more awake, so that's good. But I still sleep a lot. I am probably gonna make more videos as time goes by because I'm gonna have this till the 20th of May, so I'll probably be making more videos. Yeah, anyway, I'll talk to you later. My freaking left hand is so shaky. Well, shakier than usual. My right hand is my dominant, so I've had to do everything with my left hand, which I haven't really been able to do that many things with it, so I've had to have a lot of help. So that's been fun. I might talk about like the hospital stuff more later after I've cleaned up a bit, but right now I'm not going to. Plus it's kind of boring just looking at my hand for 4 minutes, so yeah. Anyway, I'll this down. Yeah, okay. Hey guys! Was it yesterday? Maybe it was 2 days ago. I think it was yesterday. I took a bath with this thing. And I was really scared to do it because obviously I can't get this wet. If I get it wet, it can get soggy and cause an infection and all that. So yeah, that's bad. So I had to wrap it up, and they have like all these different suggestions, but I decided to go heavy duty and get a big garbage bag, put it on, and duct tape it like underneath there. And I sat opposite that I usually do in the bath because I was not gonna shower with this because I was just terrified it would get wet. So instead of sitting the way I usually sit in the bathtub, I sat the opposite way so that I could hang out of the bathtub, like so. And I had to use my left hand for everything, which did not go as well as I thought it would, and I actually never thought it would go that well, but I tried my best, and I got my hair washed, and well, I didn't do it, someone else did it for me, so yeah, you just gotta do the best you can, because sorry, I'm holding this with my left hand because I cannot hold it with this hand, but yeah, so basically you do the best you can and you go with it. But it had been like 6 days or something since my surgery, and I looked grosser than usual, so yeah, I just really needed it. I might do another one maybe like the night before my appointment for the post-op to get this thing removed is on the 20th, so I think that's Monday, next Monday. I'm excited for that, except then once I get it removed, I'll be talking to the surgeon about when I'm gonna get my left hand done, and that'll probably be pretty soon because I want to do stuff this summer, and it will be nice because it'll be my left hand and I'm right-handed, so I'll finally, assuming that my right hand is healed enough to use, I will be able to at least do some stuff. Oh yeah, so it's really annoying because when it, when you get like a wound or something and it starts healing, it itches really bad. Well, that happens with this. So the wound, I can't turn my hand, but obviously the wound is on, like you saw when I showed it to you guys, I think. But the wound is there and it itches on and off. Now the past couple days have been really bad, which means it's healing, but it drives me crazy and all that. You keep it propped up all the time. So whenever I sit here, I have it propped up here, and then I have an ice pack, except it's kind of melted, so I'm not using that right now. And then when I'm in bed, I hate sleeping with this thing because you have to have it propped up when you sleep too. I'll either put it on my left side or my right, and that means that if I have the pillow here, then I have to rotate and put my hand right here. It's just so annoying. If I have it on my right side, that's fine, but then it's a weird angle and I hate that, and it can get really uncomfortable because then I have to shift and stuff, so that's annoying, but it's life. Yeah, so washing hands is difficult, but obviously I only use one hand, so what I do is I put a washcloth in the sink, and when I wash my left hand, because that's the one I use, I just put soap on the wet washcloth, and then I put soap, on like, okay, let's see if I can prop my phone. Okay, I put soap on, like right there.
And then I'll take that and rub it on the washcloth in the sink. And then I'll get some more soap and then just kind of move my hand back and forth on the washcloth to try and get my hand as clean as possible. So that's basically how I wash my hands. I have to get help with things still, but I'm able to do some things by myself. For the first couple days, I was really out of it from the anesthesia, and I am on meds still, like pain meds, but I only take them when I need them now. Well, obviously, you know what I mean. Like, I took them before because I needed them all the time, but now I don't need them as much, so that's good. I only take naproxen when I really need it now because it's strong. The Tylenol arthritis stuff I take. I don't think I've talked about any of this. The Tylenol arthritis stuff I take, usually just when it's just like a little bit painful. Like I used to take it at midnight with some food. And then, but now I just take it when I need it. So I didn't take it at midnight, and then I got up really late and took it because my hands started hurting and my arm. So fun stuff. But yeah, my phone is propped up like there, so I don't have to hold it because it's too shaky. I've had to learn how to eat with my left hand, which is really hard because I already have a shaky left hand from having seizures and stuff and all that jazz. And so I've had to learn, I basically have to eat like a 5-year-old. And instead of just holding like, well, I have to use a spoon pretty much for everything because the fork is too hard. So instead of holding it like a normal person like this, I have to hold it like, grip it like a 5-year-old does and goes, like that. So I do that. I use a tray because I usually eat on the couch here because this is like, you can see the rest here. So I have stuff next to me and then I put my hand on the pillows there. So I usually have my food over here and I have like a tray for the food. And then I put that in my lap and then I put like a dish towel here and then some napkins so that I can like eat, and then I spill all the time so it just spills into the cloth. So that's nice. And then I just have my water bottle. And oh yeah, I got really nauseated after the surgery. Well, no, so like they gave me Zofran, like a prescription, is that what word? For Zofran. And then I needed more because I was still feeling pretty nauseated. I've had to take it a couple more times. Like I took it today in the morning. But I'm feeling good right now. I was able to eat dinner. And in general, things are pretty good. Now I'm just rambling on and on. I'm excited to get this thing off, but then I'll probably get the surgery soon after, again, on this hand, so fun stuff. And, oh, it was funny because, there was the anesthesiologist who came in, he was older, and I don't know why he even came in, because he said, well, I'm not gonna be the one in there with you, but... So he comes in and he says that he actually had the same thing as me on both hands when he was younger, about my age. So he got them removed as well and he showed the scars and stuff. I said, well, this was before the surgery. So I said, yeah, I have this one, which is really prominent, and then this one, which isn't as bad. And then he looked at it, he says, actually, you got a pretty good one there. And I thought, okay, well, I didn't think it was as bad, but apparently it's a good size. Yeah, and I'm not sure why he came in there, but he was pretty cool. The actual anesthesiologist who was in there was a younger guy, and I don't think I talked about my experience, so I'm gonna do it now. As for the ER, operating room, so they took me back, they gave me the IV in my left arm because I was getting my right hand done. So then they took me back and I always like make conversation with the nurses and stuff. I don't know why I do that, but I do it every time I get surgery. The anesthesiologist and a nurse, they like helped me onto the table and then put some oxygen on me. And before, the guy asked me like about books that I liked, and of course he said, oh yeah, I'm gonna have to read those, and of course he's never going to, but he gave me oxygen. And it's funny because they usually tell me that when they're gonna give it to me, the anesthesia. But, oh, and by the way, they gave me general anesthesia. I don't know if I've mentioned that before, which I was very happy about, because general is when you're completely knocked out, and I was very happy about that. So anyway, he said, okay, we're giving you this oxygen, and I said, okay, yeah. So then he said that he was going to give me some stuff in the IV that was going to sting a little, and I thought, okay. And then next thing I know, I was out, and I was waking up. So, I guess that was the anesthesia? Whatever. But that's all I remember. Yeah, it went smoothly. Apparently, I don't really know how to explain it, but, they found on top of the Bony boss or Carpal boss, whatever you want to call it, on top of it, the surgeon said he found like some arthritis. Like, I don't know how he explained it, but it was basically some arthritis on top of it, and it was kind of worn away with holes. And I guess it's from years of irritation and hitting the tendons and the other bones. So, I mean, I'm not surprised. So, I'm wondering if they'll find it on this hand too. Maybe they will. I don't know. It's gonna be a different surgeon because my surgeon is apparently taking a leave of absence for a few years. So, I don't know. In general, things are good. As good as they can be, right? I can't, like, this is as far as I can turn my hand and my arm, whatever. I'll probably edit this, like, after I get my cast off. I'll try if my arm is strong enough and my hand, and then I'll post it. And I may post the second surgery as well. I'm not sure yet, but I just wanted to post this just because there's literally nothing else on YouTube. Like, the only things I could find about this were the surgeries, and there was one other video that I mentioned before of this girl who got it like years ago. So I figured, you know. This also happened when I got the VNS the first time in 2014. Like, I would look for videos on the VNS everywhere on YouTube, and just online I couldn't find like any. I found a couple, but they were really old videos and they weren't very detailed. And as you know, I am one for details. So that I took it upon myself to make a video about my experience and how I was about to get mine. And that's how I started this. So I figured, you know, I might as well post this because who knows, maybe someone's gonna get it done. And yeah, I will be showing what the scars look like and all that. Apparently, I thought it was gonna be like normal staples, but then the surgeon came in after and said that they were dissolvable staples this time. So that's cool. I don't have to get them removed because I probably would pass out from that. I'm just weird that way. So I'll show you guys that. Of course, I will put like a banner saying surgery, wound, scars, thingies, for those of you who, like me, get woozy from these kind of things. So yeah, drink water. Water's good for you. This is actually water and electrolytes. So electrolytes are good for you. Drink electrolytes. Do that. I think this is it for now, and I'll update you probably on the day that I get my thing removed and show you guys the gnarly wound scar thingies. I'll probably have like tape on it or something like that. I don't know. That's what my VNS had here, so whatever, you know. Okay, I'll talk to you guys later. so cool.
Okay, so here is the aftermath of taking it off. Hand hurts a lot. As you can see, it's looking irritated and bruised, which I guess is normal. He said that the skin is so sensitive here that when you cut it, I guess the blood goes everywhere, like underneath everything. When you cut it, the blood spreads, and that's why it bruises, because it's so sensitive. I probably butchered that. But yeah, you can see the threads on both sides. Okay, so yeah, as you can see, there's the stair strips. The surgeon at the hospital, he said that he would actually be doing dissolvable stitches, so that's cool. So he didn't have to take any out, but I have the stair strips, and then I guess these stitches, the threads, will dissolve somehow, I guess when I shower or something. And as you can see, there's ink underneath it, and it spells yes. And what they had me do before the surgery was they had me write on my hand the word yes, which I guess they put there to make sure they're doing the right hand, like to triple check or something. Yeah, so that's funny, it's still there. So I might be repeating a lot of stuff in this video just because it's not all one day and I don't remember everything that I've said. I started this video the day of the surgery, so let's start at the beginning. So I made the video of the day, or the morning of, but I'm gonna talk about when I got there. When I got to the place, I went to a surgical center, and I had to be there by 7:30, so I got there, filled out a bunch of paperwork, basically signing my life away, and just a bunch of other stuff. Then I got taken back pretty fast, and it said on the paper that my surgery would be at 8:45 or something, which is pretty cool that it said that. So I was taken back. They had me change into those wonderful gowns. Yeah, so you change, you get in the bed, and put your stuff in this bag, the belongings bag they give you. They had me put on like a hair net, so all my hair was underneath it, or in it. They had me write the word yes on my right hand, yeah. They gave me an IV in my left arm. I always hate IVs, they hurt. They give you saline, I believe, to hydrate you since you haven't been drinking. So then that makes you shiver because it's cold. After that, the nurse took my vitals and stuff. Oh yeah, so they always take your temperature before you get the surgery done. Just to check to make sure you're not sick or anything. They checked my temperature and I actually had a fever, but it wasn't like a really like severe fever or anything. But I did have a fever of like 99.5 or something, which to me is actually more of a fever than most people because I actually run cold. I usually run in the 97.8-ish. So yeah, they're like, oh yeah, you're actually hot. And so then they took it again, still hot. So they got something else, like a different thermometer, and I still had one. So I was, kind of freaking out there because I didn't want to have to go home. I wanted the surgery done. So they went and talked to someone and they said, and someone else came in, I think it was like the anesthesiologist or something, and he said that there's no worries, that they don't worry about it unless it's like 101 or something.
So I was fine, which is good. But that was like really surprising when it happened. And I actually heard someone in the little room next door, the curtain next door. And he actually had a slight fever too, so that was interesting. So I calmed down after that. Then I met the other anesthesiologist who was going to be in there with me, and then I saw my doctor or the surgeon, and he explained what was going to happen, obviously, even though, they always do that. And yeah, so then after that, probably 10 minutes later or less, they got me rolling down the hall, and there was like someone's birthday or something, because one of the nurses that was pushing me said, "Oh, it's someone's birthday, happy birthday." And I said, "Yeah, go get some cake," which was stupid of me, but because they were literally taking me to the operating room, they're not gonna get cake. So they take me to the OR, and they're like the only two in there, but they have me get up off my bed, like scoot over to the table. After that, he said, well, he had the oxygen mask on me, and he said, "Okay, I need you to breathe in really deep." And I was okay. And then he said that he's putting something in the IV that's gonna sting a little bit, and it's okay. And I'm used to them like telling me that they're putting in the anesthesia, but I guess that was probably anesthesia, because right after that I was out, and next thing I know I'm waking up, and they're saying like, "Oh, she's coming to," or something like that. Yeah, the procedure I guess takes less than an hour, and they rolled me back, and I was just completely out. My mom took pictures of me. I was in there, and then I realized as I was coming out of it, underneath the blanket, my right hand, or like my right arm, was like something was on it, and I thought, "Oh yeah, it's a cast." And yeah, so that was in a cast, or whatever you want to call it, because it's like it's soft. It's not rock hard because they use like the soft gauze stuff, but they do something to it. After that, my mom was just waiting for me to come out of it. I didn't want to come out of it. I was having a wonderful time. That was the best sleep I had had in a while. Oh yeah, it was great because I actually ended up getting general anesthesia, which was awesome, because my mom had told me, like, they hadn't told me what kind I was getting, but I kept doing research asking, or like wanting to know, what type this surgery would probably give me. Because there's a bunch of different types. And I was scared because some of the websites were saying different things. Like one was saying local, and some were saying just sedation. And then others said general. And I like general because you're completely out. And that's all I've ever had. Like with the VNS surgeries, I had general. And like with my wisdom teeth, I only had sedation. And I was still out, but it freaked me out to have like this kind of thing done where they shave the bone down and take out some bone, and to not be totally out. So when I was signing in on the papers, it said type of anesthesia is general, and so I was so excited about that. I was nauseated. They were giving me nausea stuff because I always get nauseated after anesthesia. So actually, before I went out, they said, "So you get nauseated?" And I said, "Yeah." And he said, "Well, we'll give you this. We're not, like, I don't know if it will do a ton. It'll help, but." And I said, "Okay, whatever." But basically, yeah, I get sick if I don't have nausea stuff after anesthesia. I'll like vomit and stuff. So they were giving me a bunch of nausea stuff and pain meds. I was just laying there for a while, and they would come in and ask how things were. And my surgeon came in and was telling me what happened. He said everything went well. Yeah, so then I finally, after a while, kind of sat up and was able to like sort of get dressed. Like the nurse had to help me a bit. Then, of course, they put you in the wheelchair, and then they wheel you out. And I was like freaking out, saying like, "Oh, I don't know what I was doing." I was like talking about other people, and then the nurse told me I need to stop that, and then I need to focus on myself and no one else, and I need to focus on healing. So yeah, my mom and I drove to Walmart because that's my pharmacy, And she had me in the car and she ran inside because I was not gonna go inside after surgery. She got my meds for me, which were like the nausea and the opioids, the one I'm talking about. The oxycodone, yeah, something like that. It was naproxen, then she got one. These were all the ones that they had been using. A Tylenol that's also like Tylenol arthritis or something like that. Yeah, so she got those, and then we got home, and I got in bed, slept, and that's what I've done a lot. I've done a lot of sleeping. For the first 5 days, I was just sleeping nonstop. Then I started coming up and sitting up more. Like, I would still get up and stuff because, it's not good to lie down all day and all that, especially after surgery. But after a few days, I pretty much just would come upstairs and sit up here and prop up my hand and ice it and all that because you have to keep it elevated. The only thing that really annoys me, especially, is that my phone is really hard to use with my left hand. Like, I can do the whole swiping thing from letter to letter, but it's hard to use with my left hand. But that's okay because it's just how it is right now. So you have to keep it elevated for quite a while. They didn't tell me how long, but I kept it elevated. Like, today I got it off, and it's been 13 days since the surgery, and I stopped elevating it maybe 3 days ago, just to be safe. So I give myself B12 injections, and I had gone like 2 weeks almost without them, and I give them every week. So I had to like kind of get help to do that. You don't really realize how much you rely on your hands and your arms until you can't use one of them. With the pain meds, I had to have my parents come down and give them to me in the middle of the night, in the morning, and stuff. Luckily, I don't need them as much anymore, but when I do need them, I need help. I need help taking my meds because I can't open the stupid thing, and I can't hold something with one hand, and I can't hold anything with my right hand. So, like, my mom will give me the pills, and then I'll be holding those with my left hand, and then she'll hold the water bottle up so I can get some water and put them in my mouth. Same with, like, chapstick. She has to put that on for me. Like, I only eat certain things because I can't eat other things. Some things are easier to eat with a fork, some are not. I have my phone propped up right here, so that is why that just happened. There, free hand. So, it's been frustrating. Like, I can't fill up my own water bottle. I have to have my mom do it. You just gotta get used to it. It's gonna be frustrating, but you'll sort of get used to it. It's not for super long. Mine was 13 days, but they really say, like, they can do 10 days, but, like, my appointment was already made for 13 days after, so, yeah, I got that chopped off today. Just went in, the nurse lady cut it off for me, and then the doctor, he came in and was looking at it, and he had me, like, kind of move my fingers around to make sure that, it's looking okay. Steri-strips, he said that those will, when you start getting it wet, they will start peeling, and then you can just kind of let them peel off. He said not to submerge it the first day in water, so, like, no baths or whatever, which is fine because I can't even do it because my hand freaking hurts. I'll have to start doing some exercises, but he said to listen to my hand, and if my hand starts hurting, to stop. He said that, in a little while, I need to start massaging, like, around the scar, which sounds awful, and I do not want to do that. But he said in, like, a couple days, start doing that, as long as my hand isn't hurting like crazy. Then later to actually do it on the scar, so the tissue moves around and stuff. He said that things should be fine, I should bounce back He said, this makes me sad, because I was hoping to get the surgeries, like my left hand done pretty soon, like a few weeks after this one, after I got the wrapping off. But he said that I have to wait till it's like pretty much totally better, which will be like 6 to 8 weeks. So that's not happening in a couple weeks, which I was hoping it would, but no. Which, I mean, makes sense because I can't even like move it right now without it hurting like crazy. It's frustrating because I thought that it would, like, I knew it was still gonna be sore, but I didn't expect it to. It's almost worse now that I got it taken off because my hand has been supported for 13 days, and even though it's hurt obviously from the surgery, it's been supported, it's been held up, and now it's not. Even bending it down, I'm not going to because it hurts. Even bending it down hurts. So I'm like being super careful with it. And after I got it taken off, my mom and I went out. I got a glove and put it on my right hand because I did not want it getting dirty. I don't know, maybe I was just being too paranoid, but I mean, it's still pretty like vulnerable. So I didn't really I don't trust it right now. So it's really cool seeing the stitches. It's weird because I get woozy with blood, like when I get blood taken and stuff and see all that blood, I almost pass out. Sometimes I do pass out. But this I think is cool, even though like you actually see the stitches that are like tied up and you can see them like going through the holes. Just pretty cool. And then I have like, it's so hard to.
It feels like a scab almost, and that could be from like something they put on it in surgery. And then you can see that red. So it's not focusing on it because my phone is stupid. But yeah, that's one of the holes from it. Can't really see it here, but my entire hand is just a bruise. Yeah. And it's all wrinkly, just, because it's been wrapped up and stuff. But, I'm not gonna post it yet, because first I can't, because my hand. And second, I'm going to be documenting the rest of the process and stuff. There's that for now, and yeah, I'll talk to you guys later. Here is my hand after I took off the bandage. The stitches are still on the side. They're supposedly dissolvable, but they've been there since, well, they haven't dissolved yet. Yeah. So there's still like some purple, and that's the ink from when I wrote on my hand before the surgery. Like, I just wish the stitches would dissolve already. But yeah, it's looking really good. It's amazing, actually. I mean, look at that. It's amazing. It's looking more red on the camera than it really is. Just because the flash is making it super red. But it's actually pretty light. I finally am making this video, because I took off the bandage. Like, it was pretty much all, it was pretty much all peeled off. So I just peeled the rest off. Today is exactly, I think I got the surgery on the 7th of May, so it's been like, almost a month. I have to wait till this is completely healed and not hurting anymore before I can get the other surgery on this hand. Yeah, at first I was like upset because the doctor said like I would have to wait till, until it was like all the way healed.
But I'm glad he said that because I had no idea it was going to be still painful like this. I mean, obviously it was going to be painful, but I didn't think it would like stay like this for a while. But it is, and I'm practically living on naproxen and Tylenol. I've probably talked about this already because I've made like several videos over the past few weeks. I'm practically living on that stuff, but I don't have to take as much as I used to, which is good. But yeah, I'm not sure when the next surgery will be. I have to wait till this is all healed, like I said. I'll have someone else be doing the my left hand. But yeah, I mean, overall it's been like on and off. It's like I said, it's not as painful as it was, but you know, like I have my good days and my bad days. So yeah, I mean, I think I covered everything. I won't be like documenting the next surgery just because my channel is focused on epilepsy, and I didn't really think anyone would care much about hand surgery. So thanks for watching, and I'll talk to you soon.